Is it normal to have a dry orgasm? That's a question that can cause confusion, fear, and even shame. But today, you're going to get real clarity. Hi, I'm Dr. Girag Mihai. If you're someone who values truth, body awareness, and aging with confidence, subscribe now and tap the bell. I break down male health topics with clarity, science, and zero shame, so you never stay confused about your body again. Let's talk about something intensely private, but surprisingly common: dry orgasms. Today, we're going to discuss something that may be incredibly confusing and even alarming. For a man, it's an intensely private event, and one that often occurs without any notice. You're intimate with your partner. You sense the rise of arousal. The excitement peaks. You notice the distinct pulsing contractions of an orgasm, but then nothing is released. The climax occurs, yet there's no semen. It's what we refer to as a dry orgasm. The first time this happens, a man's thoughts may race. Am I damaged? Is something seriously happening to me? Is this the collapse of my sexual function? Let's talk about the title of this video. When this happens, do this. It might sound like I'm offering you a secret tip or a magical home remedy, but as a doctor, I can share that the most essential step to take in this moment is an A, gimmick. It is to replace fear with knowledge and uncertainty with a solid action plan. Today, I'll help unravel this experience. We'll break down why it happens, the most frequent reasons in men past 60, and most critically, the clear, reliable, and practical steps you can follow. This isn't about shortcuts. It's about science. And this is a topic you completely deserve to understand. Part 1. Demystifying the disappearing act. What is retrograde ejaculation? First, we need to label it. The leading explanation for encountering a dry orgasm is a condition named retrograde ejaculation. To grasp this, I want you to imagine a basic fork in the road. In your anatomy, the urethra is a channel that transports both urine and semen out of the body, though never at the same moment. At the bladder's base, there's a small but strong muscle called the bladder neck muscle. Think of this muscle like a traffic manager at that fork in the road. The traffic manager loosens up, letting the gate to urethra open so urine can pass out of the bladder. The traffic manager is supposed to slam that gate shut, fully closing off the bladder entrance. This ensures the semen chooses the only remaining route, forward and out via the penis. In retrograde ejaculation, the traffic manager fails its task. The bladder neck muscle doesn't seal shut. So when the powerful contractions of orgasm hit, the semen, following an easier route, moves backward or retrogrades into the bladder instead of out. The first and most vital thing to understand is this: the condition is not harmful. The semen simply blends with urine in your bladder and is flushed away the next time you urinate. It's not an indicator of cancer or any serious disease by itself. However, it can point to something else that needs looking into, which we'll now explore. If this is helping you understand what's going on, type 1 in the comments and hit the like button. Let's continue. Part 2. The usual suspects, most common causes after 60. So, why does this traffic manager muscle suddenly fail? Especially in men over 60, there are several very frequent culprits. Suspect number 1, prostate surgery. This is a very typical cause. Surgeries for an enlarged prostate, especially a procedure known as TURP, can sometimes harm or alter the bladder neck muscle. It's often an unavoidable result of a necessary operation aimed at improving urination. Suspect number 2, your medicine cabinet. This may be the most frequent, yet most unnoticed cause. Some medications are designed to relax muscles for therapeutic purposes. These are commonly prescribed for both high blood pressure and enlarged prostate. Symptoms: drugs like Tamsulosin are well known for this effect. They do wonders improving urine stream by relaxing the tissues around the prostate and bladder neck. But by doing that, They can also prevent that muscle from closing firmly during orgasm. Suspect number 3, nerve-related conditions. Certain medical issues that impact the nerves can interfere with the signals reaching the bladder neck muscle. Long-term, poorly managed diabetes is a frequent culprit of this kind of nerve damage. Other neurological conditions can also contribute. Does any of this ring a bell? Reflect for a moment. Did this problem begin after a surgery, or once you began using a new medication for your prostate or blood pressure? This is an important hint. Part 3. So what should I do? Your 3-step action plan. This is the key part of our discussion. This is the do this section from the title. It's a straightforward, sensible approach to take back control of the situation. Step 1, don't panic. Collect information. The first thing to do is breathe, become a detective in your own health story. Ask yourself, when did this begin? Try to pinpoint the specific month, or at least a year. Then consider what else shifted around that time. Did you start a new drug? Undergo any procedure? That data is extremely useful. Step 2, be a medicine cabinet detective. This is perhaps the most hands-on thing you can do at home. Make a detailed list of all the medications you currently take. That means prescriptions, over-the-counter drugs, everything. If you're on an alpha blocker like Tamsulosin for your prostate, mark it with a star. This list becomes your most valuable tool. Important: never stop taking any prescribed medication without first speaking with your doctor. Abruptly discontinuing blood pressure or prostate drugs can be dangerous. This is purely for documentation. Step 3, book a doctor conversation. This is your decisive next move. Set up an appointment with the physician who oversees your medications. When you go in, be ready. Say something like, "Doctor, I believe I'm experiencing retrograde ejaculation or dry orgasms. I noticed it began roughly 3 months ago. I'm currently on several medications. I'd like to understand that there's a link and what can be done about it." This turns you from a worried patient into a knowledgeable participant in your own care. Are these facts making sense to you? Type 1 if this cleared things up, or 0 if you need more info. Your comments help guide what I cover next. Part 4, what are the medical options? Managing expectations. So, when you have this talk with your doctor, what should you expect? There are few potential routes forward. If your retrograde ejaculation stems from medication, this is often the simplest case. Your doctor might be able to change your drug to another class that doesn't carry the same side effect. Sometimes, even modifying the dose or timing can help. In certain cases, if fertility is a concern or the experience is very upsetting, your doctor may suggest medications like pseudoephedrine, which help tighten the bladder, neck muscle. However, these medications may raise blood pressure and aren't suitable for all patients, especially men with heart issues. This is a decision best made cautiously with your doctor. In situations where the issue is long-term, such as following major surgery, the goal shifts to understanding and emotional acceptance. It's important to know the enjoyable feeling of orgasm remains. The physical experience is not lost. Realizing the condition is harmless, and knowing that sexual pleasure continues can offer meaningful reassurance for many men and their partners. Conclusion: from confusion to confidence, a dry orgasm may seem startling, but it's not a medical enigma. In most cases, it's a known consequence of necessary treatments or surgeries that improve other aspects of your health. The answer to "what should I do" is not a secret. It's simply this: recognize what's happening, retrograde ejaculation, investigate potential causes, medications, or procedures. Communicate clearly with your doctor to explore solutions. This does not mean you're any less of a man. It's a mechanical issue with a well-understood biological explanation. By taking these steps, you shift from fear and uncertainty to knowledge and control. If this helped you see things more clearly, do me a favor. Subscribe and turn on notifications. You don't want to miss practical men's health tips like this. We love hearing from you. What part of this video helped you the most? Your insights inspire us to keep creating clear, compassionate health guides. Sparkles, your feedback fuels this channel and might help another man in silence right now. So please, type 1 if this helped, 0 if not, and share this video with someone who needs it. Stay empowered, stay informed, and always stay connected to your health.